because men develop what is known as erectile dysfunction. This has something to do directly with blood pressure, because once again, the act of sexual intercourse in a man involves the pumping of blood supply selectively into the male sexual organ. The same effect applies to the woman. So that high blood pressure will actually affect her ovulation. Apart from affecting her sexual wellness, will actually affect her ovulation. So she's not able to rise up to the occasion and be able to participate in the sexual act.
The blue pill might actually end up affecting your blood pressure. Is that something that you can confirm?
Yes. So the blue pill has been touted as a wonder drug. It initially was made really for the lungs. It was discovered almost accidentally that blue pill is very good for erectile dysfunction.
Hi guys, and welcome to my YouTube channel. Once again, this is the second episode of our series on our sexual and reproductive health and hypertension. So I hope that you've been able to watch the first episode of this, where we were looking at our contraceptives and sexual and reproductive health. So in this particular episode, we're going to look at sexual and reproductive health and hypertension. Specifically, we're going to look at how hypertension or high blood pressure can actually affect your reproductive health as a man, your sexual and reproductive health as a woman, or your sexual health as a man as well. Karibu sana. Please subscribe to my YouTube channel. Before you even continue watching this particular video, make sure that you're subscribing to my YouTube channel. Make sure that you're sharing this particular video. My name is Aida Munzati. I'm a sexual and reproductive health professional, a health and science journalist, as well as a digital health content creator and influencer. And once again, I'm joined by Dr. Daniel Nduiga. He's a cardiologist and physician. Daktari, karibu sana.
Asante sana, Aida.
And asante tena for your time,
yes,
even as we talk about, of course, hypertension and the sexual and reproductive health. To someone that did not watch the first episode that we did of contraceptives and hypertension, where you got to explain what exactly hypertension is, or high blood pressure is, just like a small definition of what it is.
Thank you so much, Aida. In the last episode, we went through what hypertension is. Hypertension is defined as persistently elevated high blood pressure. We have cutoffs that are universally accepted. One that has been there for many years is a blood pressure of above 140/90 in at least 2 or 3 different readings, done when the person is seated comfortably, done in the left or the right upper arm, and they should not have taken coffee or tea in the immediate supervening period. We're very interested in more than one reading, maybe in different times, because it's just that's a measurement of the force of blood through the blood vessels. We mentioned that the heart provides the force, the blood vessels provide the channel through which the blood flows, and if you have either constriction of the blood vessels or narrowing of the lumen of the blood vessels, it decreases the pressure. That's what we measure as a blood pressure. We mentioned in our last reading, our last video, that hypertension does have deleterious effects upon the brain, upon the eyes, upon the heart, upon the kidneys, and upon the sexual organs. And today we'll be focusing and narrowing in on the sexual organs and sexual health, and reproductive health also.
All right. Thank you so much for that. You've mentioned what I wanted to say. Actually, wanted to say that in the last video you spoke of how hypertension affects different organs, and of course that is at the sexual organs, and in the long term, of course, affecting your reproductive health. So how does this happen, or how does it manifest?
Yes, this is quite important. For a long time, we have known that high blood pressure will affect men disproportionately, because men develop what is known as erectile dysfunction. This has something to do directly with blood pressure, because once again, the act of sexual intercourse in a man involves the pumping of blood supply selectively into the male sexual organ, so that it becomes detumescent, so that it can actually engage in the sexual act. So if you do have narrowing of the blood vessels, or too much force in those blood vessels causing them damage, the male sexual organ will not be able to perform its function. So that's erectile dysfunction. We do know that high blood pressure also causes damage in the rest of the body organs. In the heart, for instance, the heart cannot be able to handle that excitement. It causes things like stroke, where the man is unable to even get into positions that are required. So blood pressure will actually cause a big effect on the sexual health and wellness of the man. We've recently discovered, it's been demonstrated, that there's such an entity as female sexual dysfunction. We do have changes in the blood supply in the sexual organs of a lady, so she's not able to rise up to the occasion and be able to participate in the sexual act. So once again, that's a wellness side of blood pressure having an effect on the sexual organs.
And does it, of course, you've mentioned of the sexual organs, and of course, when the sexual organ is affected, the chances of their reproductive health being affected are also high. I will say that, but it's up to you to tell us if that's true or not.
Yes. So we've known for a very long time that when the man suffers from erectile dysfunction, he basically cannot reproduce because he's unable to provide the semen required for reproduction. We've also learned quite recently that the same effect applies to the woman. So that high blood pressure will actually affect her ovulation. Apart from affecting her sexual wellness, will actually affect her ovulation. Then you know that high blood pressure does affect the ability to carry a pregnancy to term. And the many illnesses we might be able to get into it. But blood pressure in pregnancy or around the time of conception is not very good because it does affect the ability of that woman to carry a pregnancy to term. Once again, these areas we as a physicians cardiologists share with urologists, who are specialists in men, genital and reproductive health, and the gynecologists who take care of women and the reproductive health.
All right. Of course, you've mentioned of how high blood pressure will affect, that is the ovulation, and I want to assume that this is now basically affecting the menstrual cycle of this particular woman, and in turn they may be unable to either reproduce, affecting their fertility. So you've talked of we can now just focus in men. So you've talked of erectile dysfunction. Is there like any other condition that men will also experience as far as hypertension is concerned in their sexual health?
So erectile dysfunction is the main thing that we see. In addition to that, we do know that blood vessels do get damaged by high blood pressure. The heart can get damaged, kidneys can get damaged, so can the brain. So that a patient who actually has stroke or kidney failure or heart failure may be unable to perform sexually. Partly because, for instance, heart failure, which is a major consequence of hypertension, will make sure that it doesn't have enough blood to supply to the sexual organs, even for the functions that is required to perform. If a gentleman develops a stroke, then he cannot be able to perform in bed. And if someone has kidney failure, then you get problems with anemia, which affects once again sexual health, problems with high blood pressure, problems with something known as uremia. All of these things have a deleterious effect on the sexual health of a gentleman.
Okay, and of course, just to a disclaimer, that is not just hypertension that causes erectile dysfunction or these other conditions that we've spoken about. That is just one amongst the causes of erectile dysfunction. Okay, and of course, we've looked at that is the problem part of it. Is there like a solution? Is there, or what does the treatment plan looks like for this particular man or woman that is undergoing these sexual challenges as far as hypertension is concerned?
We want to diagnose you as quickly as we can. Please come in. Allow us to check your blood pressure twice or thrice in the left or right upper arm in a seated position after 15 minutes of rest. If we do diagnose high blood pressure, we most likely put you on medication. We may want to do a few tests to understand why you have high blood pressure. For instance, we'll check your kidneys, check your cholesterol, check your thyroid, check your uric acid, understand whether or not there's a good cause for the blood pressure developing. We'll ask you questions to do with your lifestyle. Do you smoke? Do you take alcohol? Do you exercise? We'll measure your weight and your height to get your body mass index. We'll ask some questions about your life so we understand about your family. Is there a strong family history of high blood pressure? Now, when you diagnose high blood pressure, we'll treat it. And many times, within about 2 weeks, we're able to control your pressure. And for the majority of our patients, we're able to restore their sexual function. Having said that, we do know that there are some drugs that are known to also cause what we're trying to prevent. We could give you medication to control blood pressure and so restore your erectile function. But then there are some drugs that we do know do affect the blood flow to the male sexual organs. We do know that the same can happen to women. We can give them some drugs that can cause some drying in the reproductive areas that can actually affect the performance of the sexual function. So it's actually a two-way road, and we work with you to make sure we give you the right drugs that are good for you. And then over and above that, when you're preparing for children, for conception, we help you with the drugs that can actually control your pressure and make sure that you sustain pregnancy to term.
Okay, so just to get you right, that there are some drugs, that is drugs to manage and control hypertension that you may give this particular man or this particular woman, and it might end up like affecting them. Is that like interaction of drugs or?
We normally talk about drug side effects, which means that the drug does its work, but does something over and above that. Because once you ingest medication, it goes to, we call them the receptors supposed to work in, but also goes beyond those receptors to other receptors that you may not be very interested in it working there. Having said that, we have a lot of drugs these days. So the ones that would actually worsen or cause erectile dysfunction, we're able to remove and give you gentler ones or ones that are able to help you. We also have ways to ameliorate the symptoms if they're severe. But first and foremost, please allow us to diagnose the disease in the first place. Look at your lifestyle, assess you and see if there are any causative factors promoting and upholding the blood pressure, so you can address them directly and the blood pressure be controlled.
Okay, so I don't know whether this is in line with what we are discussing, but for example, let's give an instance of a man that has a problem with erectile dysfunction. Erectile dysfunction. Then they end up, for example, going over the counter and getting, let me say, the blue pill, because we've seen that it's something that is being, I don't know whether to say misused with majority of men. We've seen a couple of stories in the on TV, on internet, how some men are actually misusing the blue pill. So would you say, and I've seen that one of the side effects, it's that the blue pill might actually end up affecting your blood pressure. Is that something that you can confirm? Or
yes, so the blue pill has been touted as a wonder drug. It initially was made really for the lungs. We know that the blue pill does improve blood supply to the lungs and reduce some pressures in the lungs. It was discovered almost accidentally that blue pill is very good for erectile dysfunction. Now, the blue pill taken in a gentleman who hasn't had a heart checkup, there is a risk that the arteries of the heart could have already narrowed, as we see here, and the gentleman has no idea that the arteries in his heart are actually narrow. So that when they do partake of the blue pill, there's what is known as enhanced nitric oxide, which is one of the molecules that helps or signals the sexual function, that increases, but also increases where the heart is concerned in the setting of arteries that are already narrow. And we found that that is actually a major cause for the misadventures that have happened to our gentlemen who have taken the blue pill without physician and doctor guidance. So if you are suffering from erectile dysfunction, please come in, allow us to assess you, allow us to assess the heart. And then if we find that you are fit, there's nothing to treat here, we can go ahead and give you the blue pill, or others that the blue pill has to be taken within stringent guidelines. The others that are actually easier to work with and are not so stringent, we can do that for you. And even if there's a problem with the arteries of the heart, we're able to take care of them, restore you, so that we can actually restore your sexual function. Don't do it on your own, in other words, what you're saying. Please allow us, come in, allow us to do a checkup, allow us to assess and see where you are, and give you the right dose for you that is safe for you, so you can enhance and promote your health and your life.
All right, thank you so much. I like what you've said. The bottom line is basically, do not try to self-medicate. Do not try to treat yourself. Always go to the doctors, experts, and especially so that checkups are done and you're able, like, the right problem is able to be treated, the root cause of it, and not just whatever you're seeing. All right, thank you so much, Daktari. I know that you mentioned of now hypertension in women and how it can affect their reproductive health in terms of pregnancy, and that is what we will be looking at, of course, in the next episode as we look at hypertension and pregnancy. But before we wrap up, just a parting shot to our audience.
Thank you so much, Ida. I'm really grateful. And for your audience, thank you for tuning in and listening to us. We are discussing hypertension and sexual health. And we've said that hypertension can affect both the man and the woman's sexual health. So please get your numbers checked. We recommend that come in. Let's have a look at your blood pressure. Let's have a look at your weight. Let's have a look at your lifestyle. See what you can do to enhance and promote your health. And if you do have high blood pressure, not necessarily that you're going to be on medication. Allow us to assess you properly, look at your hormones, look at your blood, look at your cholesterol levels, for instance, look at the way you live your life. Some of these patients just need a change in the way they handle themselves in their lifestyle, and they control their pressure and enhance their sexual productive health.
All right, thank you so much. That is Dr. Daniel Nduiga. He's a cardiologist and a physician, and today we were basically looking at hypertension and sexual and reproductive health. This is the second episode of our series on sexual and reproductive health, of course, and hypertension or high blood pressure. Thank you so much for watching. Please make sure that you're sharing this particular video so that together we are creating awareness and also spreading education about sexual health and hypertension. My name is Ida Munzati. Please don't forget to subscribe to my YouTube channel. You can forget to like and all those things, but make sure that you're subscribing to my YouTube channel and also hit the notification button so that you're notified every time I upload a video. Once again, I'm Ida Munzati, a sexual and reproductive health professional, a health and science journalist, and a digital health content creator and influencer. Thank you so much for tuning in. See you in the next episode.